This is the Windshield survey and community assessment regarding hypertension and exercise associated with hypertension, presented by Dominic Pease, Lindsay Wolchik, Rebecca Zimmerman, and Zaina Draka. Upon assessment of the area in our Windshield survey, we noticed the poor, rundown-looking houses. There is a church on the corner of Seneca and Empson known as The Church by the community. There is another church a few blocks away down Seneca Street. There is one corner store available, and there is a main bus line running down Seneca Street. The community is 1.541 square miles with a population of 11,615 and 7,536 people per square miles. The population in Babcock is made up mostly of Asians alone, followed by whites alone, then blacks alone, and the remainder is brought up of white and American Indians, white and blacks, other, or the rest, small percentage of Hispanics. Median age for males is 29.4 years and females 39.8 years old. In 1939 or earlier, there were 3,990 houses built. That was the greatest time period for the greatest houses built. There was just plenty of workers available. From 1940 to 1989, it seemed to fluctuate, never going above 743 houses built. But from 1990 to 1999, 1,028 houses were built. 2000 to 2009, 654, and anything after 2009, no other houses were built. So most houses are very old and don't have the proper necessities for these families. A lot of families seem to rely on space heaters to keep the house warm, and only maybe 4 or 5 rooms, and trying to fit 7 persons per the house. In regards to education, there's 20.1% of people 3 years and older in grades kindergarten through 12. 11% of people 3 years and older in undergraduate colleges. There's only 1% of the population 3 years and older in graduate or professional schools, and only 8.1% of kids in kindergarten through 12 enrolled in any private schools. In regards to safety and transportation, the I-190 is easily accessible within this community. Most people seem to drive a car alone, while the remainder, there's other mode of transportation. They either carpooled or they could take the bus. The bus line does extend to the I-190, and it also extends down Seneca Street. The crime index for the city in 2016, higher means more crime. The average is 236.5.
Continuing with the community assessment, the politics and government that oversee the site would include the Mayor of Buffalo, the Buffalo Common Council, the Buffalo Comptroller, City Court judges, 2 state senators, and 3 state assemblymen. Health and Social Services Recreation. The Seneca Babcock Community Association includes child care services, youth services, adult and family services, and senior services. The Seneca Street CDC includes teen programs, young adult programs, a community garden, after-school programs, summer programs, a Boys and Girls Club, CACP programs, neighborhood legal services, affordable housing opportunities, and a single moms club. Within the community assessment for means of communication, we found the Buffalo newspaper or local community public newspapers, the United States Postal Services, radio, billboards, flyers or posters, local television, internet, and verbal communication between community members. Continuing with the community assessment for economics, the percentage of the population below the poverty level in this community was 41.5%. The median household income in 2016 was $21,141. The median rent during 2016 was $348. The average estimated value of detached houses during 2016, which was 36.6% of all units, was $47,586. Strengths of the community. There's a community garden, which allows people within the community and their families to have access to fresh vegetables. There's a young adult program for people aged 21 to 35 years old. This helps offer support and advice and helps work to achieve their goals, such as getting a GED or attending some college classes. There are teen programs. During the week, teenagers can have help doing their homework after school, and then there's a teens only program on Friday nights. There's after school programs. These are provided daily for kids. They help with homework for 1 hour, and they provide a healthy snack and dinner, and they do have an enrichment activity daily. There's community health initiatives, which include the community garden, and working to have the Massachusetts Ave Veggie Van come to offer fresh vegetables, which also accepts EBT and SNAP as a form of payment, and working to have the dental van come to provide dental checks. The enrichment activities within the community. There's a single moms club for those moms interested in coming that can help with supporting one another and just getting away from their families for a little bit of time every week. Over the summer, the kids can enter the summer camp. They provide for the kids to help them stay busy through a reading camp with different topics, and they bring justice into the community to provide legal services to the residents.
Of the community. Limited or no availability of drugstores or doctor's offices. This community is lacking on doctor's offices and drugstores around within vicinity of walking or public transportation that makes it harder for residents to get access to physicians' offices or drugstores, which most of them don't end up seeing physicians unless it's an emergency situation where they have to seek help in emergency rooms. The community is very poor. Most of the landlords don't live around in the state. They're out of the states and don't take care of the properties. Most of the houses don't have central heating, so the residents have to use space heaters, and a lot of properties have lead and mold, which is another barrier for families. They don't have safe environment in their houses. Large families living in cramped conditions, so the houses are very small. Families of 7-8 people live in 4 to 5 rooms, which is kind of crammed and poor. Like I mentioned before, a lot of houses have mold and lead. Single mothers struggling to get by do not have time for exercise. As the community has a lot of, mostly single moms with 4 to 5 kids, where they work on a minimum wage and don't make much of income, and they're struggling with daycares and any help with their children, so the exercise is the last thing that they're giving themselves or even doing it. Nursing diagnoses for this community is ineffective therapeutic regimen management related to exercise and hypertension. Management is evidenced by increased incidence of high blood pressure. Evidence that support nursing diagnoses. Regular aerobic exercise results in reduction of blood pressure of 5 to 7 millimeters of mercury among individuals with hypertension, that these reductions translate to a reduction risk of CVD of 20 to 30. Emerging research suggests that dynamic resistance exercise may also serve as efficacious strategy to lower blood pressure to levels similar to aerobics exercise. 28% of adults aged 18 years and over with high blood pressure, hypertension, met the recommendation guidelines for physical activity in 2007 through 2010, age adjusted to the year 2000 standards population. 33% met the recommendation guidelines for physical activity in 2007 through 2010. Minimal statistics improvement. It is recommended that 5 to 7 days of aerobic exercise, 2 to 3 days of resistance exercise, and greater than 2 to 3 days of flexibility training will help to lower blood pressure. All workouts should be at moderate intensity for 30 to 60 minutes to be effective. Factors that are associated with physical activities. Positive factors. Post-secondary education, higher income, enjoyment of exercise, expectation of benefits, belief in ability to exercise, history of activity in adulthood, social support from peers, family, or spouse, access to unsatisfaction with facility, enjoyable scenery, safe neighborhoods. Negative factors, advancing age, low income, lack of time, low motivation, rural residency, perception of great effort needed for exercise, overweight or obesity, perception of poor health, being disabled, unsafe neighborhood.
So the problem regarding exercise and hypertension in this community is that individuals with hypertension do not get the amount of daily exercise needed to remain healthy. There is a poor community with no access to gyms, drugstores, or even doctor's offices. And there's a higher chance of obesity due to the abundance of junk food and beer available at the corner store. So the goal with exercise and hypertension is to have the individual re-verbalize the importance of exercise for the prevention and management of hypertension. Also, the individual will be able to discuss that any type of exercise, such as walking, should be done for at least 30 minutes per session at least 3 times a week. Individuals will be able to state that it takes 1 to 3 months of regular exercise to have an impact on blood pressure. So primary intervention or prevention aims to prevent the disease or injury before it actually occurs. So with hypertension and exercise, you're going to educate the community on the importance of daily consistent exercise before the diagnosis of the disease process. Have community health fairs annually to continue this education on prevention of hypertension, and reach out to school-age children and educate them on the disease process of hypertension, along with the effects that this disease would play on their daily lives. So secondary intervention and prevention aims to reduce the impact of a disease or injury that has already occurred. So hypertension's already happened at this point. So regarding exercise in this, we would hand out pamphlets with daily exercise regimens that could be done to decrease hypertension. We would involve primary or the diagnosing physician in a plan of care related to exercise tolerance to help reduce the instances of hypertension. Involve community outreach programs to engage in community exercise programs, along with educate individuals on not only exercise regimens, but also on monitoring their blood pressure and keeping a good nutritional status. So tertiary intervention or prevention aims to soften the impact of an ongoing illness or injury that has a lasting effect. So these people have been diagnosed with hypertension for a very long time and are just not managing it correctly. So with this, we would educate on coping mechanisms and stress relief measures, because this could also help decrease their blood pressure in the long run. Educate on continuation of daily exercise and the importance of weight loss. For them to go to chronic disease management programs that are available within the community. These can help them understand a little bit better about their disease process, along with giving them little techniques or tricks in order to help lower their blood pressure, along with increase their daily exercise. Seek out regular doctor's appointments for management and treatment of disease. And then increase physical activity if decreased blood pressure has not been accomplished. This could be a fact of people who think that exercise could be walking down the street for 10 minutes. We would educate them to increase it to maybe 20 or 30 minutes, however they can tolerate, in order to help establish a good exercise routine to decrease their blood pressure. This is a list of our references. Thank you so much for watching this presentation.